Speed was very helpful. All of Speed's videos is what laid out the foundation for me. I went through all the videos on Speed on MCQ discussions. They were all very helpful. I just revised my notes, which I made from Speed app.
I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to you, Dr. Karthik, for scoring a topmost rank of 54 in NEET SS 2025 session and DM Critical Care Medicine group. Best wishes to you.
Thank you, sir. Thank you for having me here.
Great. And also I thank you for your time, sparing your time for valuable experiences to share with us and to the students who are watching this.
Thank you, sir. Thank you for giving this opportunity.
Welcome, doctor. So can we know your brief background from where you started till date, what all you have done?
Yes, sir. So I'm actually a foreign medical graduate. I did my MBBS from Anna Medical College, Mauritius, batch of 2012. I passed out in 2017, after which I did my internship. And yeah, after giving NEET, I took my MD in anesthesiology at UCMS Delhi, batch of 2022. And I've recently passed out in 25 February. So post that, I joined as a senior resident in private medical college in Pondicherry, and I'm still working over there. I prepared while was working over there. Yeah.
Very nice, excellent. What an achievement! Where you started and where you are ending. Amazing, amazing.
Thank you, sir.
Real zeal and a dream come true, and I mean a man to accomplish what he wants.
Definitely. Thank you.
Very nice, great.
Thank you, sir.
Now, so you decided to do for a critical care medicine, and
Yeah.
what you decided to do, and how you started your working towards it. Because I mean, I could see that you have worked your way through it. I mean, you plan things appropriately, and you work through it. I could see that. But for this exam, how you prepared, so that'll be useful for the students watching it.
Right, sir. So my first attempt in NEET was in the March exam, which I gave without any preparation. This was right after my MP's final exams were done. So I got a score of rank of around 240. So that was, I felt like I could do better with much improved preparation. So I thought I'll take a break again. I thought I'll study and I'll work at the same time. So that is when I joined in Pondicherry. And so I took up Speed in April. Exactly. This was after doing a lot of research. I spoke to the few toppers that I found in YouTube, which was again through your interviews. I spoke to them. And after coming to a conclusion that Speed was very helpful, I took up Speed again. The reason because there was no actual framework for me to prepare for CCM as such. In anesthesia, we are taught critical care, but not to the extent that we are asked in exams. And so I thought I needed some amount of definite help or guidelines for me to prepare through the exams. So that is when Speed came into to its place. So I went through all the videos on Speed, almost all, I'll say, at least 80-90%, whichever I thought was very important for me. And especially Dr. Nazreen ma'am's class and Dr. Varun Bharappa's class on MCQ discussion, they were all very helpful. So post that, my work also involves some extensive studying from OS also, because OS was what Varun sir was using as a Bible from what I figured out. So whatever I felt out was missing out was covered from OS also. So basically, this was all the curriculum that I did through. Like I just revised my notes, which I made from Speed app. Then again, I had to revise it multiple times as much as I could. That's all, sir. In between, I also gave NEET. I scored around. I took around 70s rank in the last NEET, but I think that wasn't enough. So fortunately, I got a decent score in NEET, and here I am. Sir, I think it was all Speed, sir. Speed and little bit of reference from the standard textbooks. In particular, Rose was the one that helped me a lot. And yeah, all of Speed's videos is what laid out the foundation for me, because I was literally clueless as to where to start for CCM preparation. And so that is how it turned out to be, sir. Thank you.
Okay, so you come from which place?
I'm from Chennai, sir.
I'm very happy for you.
Thank you, sir. Thank you so much.
Can you share something about the paper?
About the paper, yes, sir. Actually, even during the paper and after the paper, it was one of the most stressful exams, I'll say. It's not because of the pressure as such. It's because of how the paper was. It's a very difficult paper, to be honest. And it was one section, I think part B, it was all of onco-critical care. And it was not in what was in our standard textbooks also. It was like, I don't know where they sourced it from. So it was actually very difficult. And yeah, the first part, it was very lengthy. You had to time it out properly. And the second part, it was very onco intensive. and the third part was, I think, jumbled around. So what I feel with NEET is that they take few topics and they heavily focus their MCQs on those particular topics. Like for the past 2 years, from my experience, they are well focused on pulmonary artery catheter monitoring. So you get sure question from there, and again, as usual, sepsis and your ACLS, BCLS, and this time it was all onco based. Last time it was more of poisoning. So I feel like they just choose particular topics and all their MCQs are just sourced out from there. They try to ask as much as possible. So yeah, I'd say it was a very difficult paper. I was not able to guess how much I'd scored, to be honest. I was very scared till the results came out, and I thought I'd do worse than my first attempt, but fortunately, it did not happen.
Very nice. Great.
Thank you.
And what will be your advice for the future aspirants of critical care medicine?
Sir, I think you should start early. That is one thing that I'd say. Probably you can start preparing for your critical care. I think you'll get an idea by second or third year. So if you feel like you're interested in it, I think you should start preparing early. So you get into the exam quite early also. So I mean, not to put much pressure on yourself, but I think you should start early. And I think in retrospectively, you have to look at yourself if you are ready for this course, because it's going to be very hectic. And yeah, you'll have lots of night duties and lots of personal sacrifices. So I think you have to prepare yourself well for that. But I think it's one specialty that stays in touch with the core medicine, the acute medicine, that I'd say. So for those who are interested in that adrenaline rush, for those who like to see patients who are literally in deathbed coming out of it, so this is one thing that is going to satisfy you. But I think it comes with its own personal sacrifices, which you should be ready for.
Great, great. Time to thank, and whom all you want to thank, you feel that they helped you from day one till date. You can
Yeah,
use.
definitely speed the faculties, in particular, Dr. Nazreen ma'am and Dr. Varun Bhairappa sir. And firstly, my parents, my mother and father, and my wife who has been a great support. My in-laws also, and all my friends, my very close friends who have been there from my UG, PG days, my internship friends also, and even my colleagues at my private medical college in Puducherry, because they've all been very helpful, made sure that I had enough time to prepare, uh, and also my relatives. And yeah, thank you. And thank you also, sir.
Okay, great to have you in the session today. And you
Thank you.
shared a lot of information which will be useful for the students who are watching this video. Once again,
Thank
we
you.
wish you all the best and all the success for a great and wonderful, amazing career for you in critical care medicine. I look like, you as a kind of a person who accomplished your dream.
Yeah,
And
I think
you
I
have
feel
a
it right now. I hope this is the last entrance I give. So maybe some fellowships later on, but thankfully I'm relieved.
you are a hero material.
Thank you. Thank you. Thank you.
You are a role model for
Thank
many
you, sir.
students who are coming from foreign medical graduate
Yeah.
examination. You're proving that you can achieve beyond what is
Thank you. Thank you.
capable they can believe for themselves. That's
Thank
what
you.
you're trying to do. And this video should reach each and every foreign medical graduate students who is doing, has finished, and is aiming for a post graduation. It's not just post graduation. It is
Yeah.
not about licensing exam. It's
Yeah.
about that I can achieve.
Yeah,
So
hopefully, I think they feel the same way also. I don't think they should underestimate themselves, because the journey is very tough for a foreign medical graduate. There is a lot of bias involved. There's a lot of waiting involved. I had to miss a lot of months, and just although I have cleared all the exams in my first attempt, but yeah, these things are involved. I just feel very bad looking at the current situation, but that is how it is. So if you have the right mindset, and if you're just going to stay focused, I think you can make them.
you're a torchbearer.
Yeah, yeah, definitely.
And people, once watch the video, should get the motivation and the right mind,
Hopefully.
as you rightly
Yeah,
said, that it's doable and you are more capable than what you believe. That's what
definitely,
we should.
definitely. Yes.
Okay,
Yes.
so great to interact with you and discuss with you. God bless you. Best wishes to you.
Thank you. Thank you so much, sir.
Thank you.
Thank
Thank
you.
you.